All right, under the Trump administration, we had Operation Warp Speed, which produced the COVID vaccines. Now, under the Obama administration, it appears that we have Operation What's Your Problem? There is a push to make it difficult for those who are concerned about the growing health complications surrounding the vaccines. Here is the former president of Planned Parenthood, now an analyst for CNN, Leanna Wen.
What we really need to do at this point is to make vaccination the easy choice. It needs to be hard for people to remain unvaccinated. Right now, it's kind of the opposite. It's fine. I mean, it's easy if you're unvaccinated. You can do everything you want to do anyway. But at some point, these mandates by workplaces, by schools, I think it will be important to say, hey, you can opt out. But if you want to opt out, you have to sign these forms. You have to get twice weekly testing. Basically, we need to make getting vaccinated the easy choice. That is what it's going to take for us to actually end the pandemic.
Make it difficult, shame them, and push for mandates. Well, joining us now to set the record straight is Dr. Jay Bhattacharya. He is a professor of medicine at Stanford University. Dr. Bhattacharya, thanks so much for being with us today.
Oh, my pleasure.
All right, look, so there's growing concern over some of the vaccines. I mean, we're out to reports today that Johnson & Johnson has some health complications with it. We're still under emergency provisions for these vaccines. Should we be talking about mandates?
No, we should not be talking about mandates. I think mandates in the context of this vaccine and this pandemic are going to be very bad for public health. The public health community at large and has in many ways failed us. It politicized the vaccine, it politicized the virus, and have undermined, I think, public trust in them. If you were to mandate the vaccine, rather than just telling people, here are the numbers about for whom it's beneficial, for whom it might not make so much sense, and treat people like adults, I mean, that's the right way to do public health. Instead, we have, a push toward mandating, toward forcing, toward coercion that I think in the long run undermines trust, further undermines trust in public health. And actually, I think, unfortunately, will undermine trust in other vaccines as well. I think it's just a mistake.
I agree with you. And I'm not one who is anti-vaccine. I have not gotten the vaccine because I actually had the virus. Now, my parents are elderly. They're in the high-risk category, and they got the vaccine. That was a decision that they made, and I was glad that they took the protections to get it. Now, I'm not telling people to get the vaccine or not to get the vaccine, but I think when you have the government stepping in, as you pointed out, encouraging through mandates at the lower level or making it difficult, as we heard Ms. Wynn talking about, I think that builds the resistance to the vaccine.
Yeah, I mean, I think it's part of the American spirit. You tell people you're forced to do this or else, and Americans say, well, what's wrong with this thing that I have to be forced to do it? I mean, it's kind of this actually, in some ways, a healthy skeptical spirit. I think there's a case to be made for the vaccine, and you should just make it honestly, right? So the vaccine for older people is a godsend. It has protected many, many older people from dying from the virus, and because for older people, the virus itself is quite deadly. There's 1,000-fold difference in the risk of mortality from the disease from the oldest to the youngest. And the oldest, you have a disease that's very bad. The vaccine that has some side effects, but they're very, very low rates of side effects. Relatively safe vaccine. It makes complete sense. For younger people, I mean, it's a much closer question. Give people the information, the solid, good scientific information, and let them make their own choice. That is how public health gains trust. That's how public health becomes effective. And that's how the pandemic actually ends, not with coercion, but with good medicine conveyed by trustworthy people to people, treating them like adults as opposed to serfs.
Okay, Dr. Bhattacharya, let me ask you this question from the science standpoint. For those in the category of the younger individuals, where they look at some of the side effects, and I know that they're minimal. I mean, in terms of if you get them, they're not minimal, but I mean, percentage-wise, it's not vast. But you don't want to take that risk. if you have the antibodies and you've actually had the virus, you get it, you're younger, it's not that bad, you're a part of creating the herd immunity with that, even more so than those that get the vaccine, are you not?
I mean, natural immunity is quite effective at preventing you from reinfection. We've had relatively small numbers of reinfections, despite the fact that millions, tens of millions of people, I mean, hundreds of millions of people in the United States, I think, have been infected. 100 million people infected at least. And yet we have very few reinfections. It protects you against the variants as well. So I actually don't understand this. I read the evidence, scientific evidence around natural immunity. It looks like it's quite effective at preventing reinfections. I mean, of course, if you had the choice between getting COVID and the vaccine, it's probably better to get the vaccine than COVID. I mean,
but if you've had COVID, what would you recommend in terms of if you've had it and you have the antibodies, do you need the vaccine?
I think so. It's not even a question of the antibodies, right? So if you have had COVID, the antibodies will fade over time, but that's not the protection that you actually get from it. It's there are other mechanisms of immunity, T cells and B cells and other cellular mechanisms of immunity to provide protection against severe disease upon reinfections. You're much less likely if you're reinfected to be hospitalized or die. That's what we care about, right? Hospitalization and death, that's what overwhelms hospital systems. That's what gets headlines and of course, devastates families is having people with severe hospitalizations and deaths. If you've had COVID and recovered from it, then you're protected against that just as much as you would be if you had the vaccine. Actually, can I bring another angle to this? There are tens of millions of people, older people worldwide, who have not had the vaccine. Why are we discussing vaccinating a population of people, younger people, who face very low risk if they were to get infected, while still tens of millions of people worldwide have not had the protection of the vaccine? Just because they don't live in a rich country doesn't mean they don't deserve to have this kind of medical care available to them. If we're going to do the ethical thing, we should be sending these vaccine doses overseas to older populations, so older populations elsewhere can be protected, just the same way the American older populations have been protected. That's the right thing to do at this time.
Well, you have some countries that are having some significant issues with the COVID virus moving rapidly through those countries, and certainly they could use those vaccines. Continuing that conversation about those that have had the virus, I've read where there are sometimes significant complications for those who have had the virus and then get the vaccine.
I mean, they actually checked that in the trials. I don't think it's unsafe for someone who's had the virus, recovered, and then to then subsequently get the vaccine. I think that's actually still safe. It's just useless, because you're already protected in substantial ways against the virus from reinfection with the virus. The vaccine itself does not add any additional protection. So just to give you some sense of this, in the randomized trials that Pfizer ran for the study, they actually enrolled a large number of people who had COVID and recovered. They tested the vaccine on them and found, it was a safe vaccine for them. But then when they were testing the efficacy of the vaccine, they dropped that group out of the trial. Why? Because they knew that if that group had no benefit from the vaccine. And so if they were to include it, it would make the vaccine look less effective than it actually is. So why are we then giving the vaccine to people who've recovered? It doesn't make any biological sense. It's not consistent with the evidence.
Well, and it's also, if we have a limited supply, we want to get to those people that are in higher risk categories. But are the public health models taking that into consideration? I mean, I've not heard any conversation about those that have had the virus, being outside these, mandates or encouragements for the vaccine.
Yeah, it's really weird. I mean, a very odd denial of natural immunity. I don't understand it. It's as if the only valid immunity is vaccine-induced immunity. I mean, vaccine-induced immunity is actually quite effective, but it's not. But if you've had the virus and recovered, you have natural immunity. There are an enormous number of studies in prominent journals that have established this. I don't really understand why the public health community has not adopted this, has not sort of incorporated this into their thinking in a deep way. We keep seeing this mistake over and over. And, actually, I think it's actually led to deaths that we should not have happened. We should have prioritized people who didn't have COVID before when the vaccines were in short supply, right? If we had done that, we would have been more effective in sort of putting the vaccine into the arms of people who would benefit from it when the disease was spreading very rapidly. And now that the disease is spread, sort of the disease in many ways is come down in prevalence. We're deciding that we're going to give the vaccine to patients who don't really benefit ton from it. In any case, just by dint of their age, while ignoring people overseas that need the vaccine that actually could benefit from the vaccine. It is a public health policy. It's a puzzling public health policy.
So let me ask you this question, Dr. Bhattacharya. Is it because of the politicization of this issue that it doesn't make sense to do it this way, but because it's become a political issue, that's the way we're doing it?
I mean, I don't know the answer to that. I wish I knew the answer to that. I think part of it. Let me try a charitable interpretation. The charitable interpretation is that the public health officials that are pushing this message have an incorrect understanding of what the endpoint of this epidemic is. They think that the endpoint of this epidemic is everyone is immune by dint of vaccination, and then the disease disappears off the face of the earth. That's what they think of as the endpoint. That is actually a fantasy. The disease is never going to disappear off the face of the earth. It's too widespread in every country on earth. It will continue to spread just like the other 4 circulating coronaviruses, which are common cold viruses, will continue to spread through the whole population. At some point, everyone will be exposed to it at some next year, 2 years from now, 10 years from now. It's not possible it's not possible to eradicate the disease. Dogs can get the disease, can get the virus. Cats can harbor the virus. It has extra human vectors. This is not an eradicable disease. I think they mix up the goal in their head and say, okay, this is potentially eradicable, when in fact it's an endemic virus. It's a virus that will last essentially forever. As long as they're humans, will now have this virus. It'll join the 200 other virus pathogens that afflict humans. For older people who are vulnerable, that really have a high risk of disease or death if they get the infection, they should be protected from it. Younger people, I mean, there really isn't as compelling a case to be made for that kind of protection. They die at much, 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 much lower rates, thousandfold less. I think we need to stop being scared of this virus. I think that's the fundamental. I think they're still motivated by the fear of the virus.
I think you are absolutely correct. So to summarize, we should look at the science, the facts, look at your vulnerability, and then make an educated decision as to whether or not you should get the vaccine or the shot.
I think that's exactly right. I mean, and frankly, if that attitude prevailed in public health, more people would be vaccinated because they would trust the public health officials that were making that case. Instead, what we have is a coercive kind of forced vaccination effort where it's going to create distrust. It already has created distrust. And as you say, politicization. I think it's very, very unfortunate.
Well, Dr. Bhattacharya, thank you so much for joining us and just having a reasoned conversation about this, because I think the facts need to be out there and people need to look at the science and make an informed, educated decision.
Thank you for having me. I really appreciate the conversation.
All right. Thanks so much.